What is going on, everybody? Good evening, and welcome to another episode right here with the Kettering Health Chats. My name is John Stamper from Medcast Productions, and today's episode is COVID-19 and mental health. And I have to tell you, before we went live here, we have a very special guest, Dr. Steve Taylor, and I am so intrigued about what he's going to share today because I'm sure for so many of you watching, this has been a topic that I know has been on the minds of many. As so many of us have gone through this pandemic together, and we know that mental health has certainly been something that that people have been thinking about a lot. So we are very excited and honored to have Dr. Steve Taylor with us today. Dr. Taylor, it's very nice to see you. Welcome.
Thank you so much for having me. Appreciate the welcome.
Absolutely. All right. So before Dr. Taylor starts, just want to let you all know a little bit about him. He is a psychiatrist, and his practice is part of the Kettering Physician Network and has been for the last 5 years. So one of his passions for this field is to help others debunk the myths about mental health problems, as well as to demystify psychiatric and make it more accessible to others, which is such a special gift that he has given. Now, he graduated from medical school at Tufts University in Boston, Massachusetts. However, he completed psychiatric residency training at Wright-Patterson Medical right here in Dayton. And he's worked in a variety of locations we were talking about before. He's lived all over the world, Arkansas, Colorado, Japan, before returning to Dayton in 2008. I know for many of you that know Dr. Taylor, I'm very, very happy to have him here in Dayton. So Dr. Taylor, again, very excited to speak with you today.
Thank you. I appreciate that.
All right, so we're going to dive right in. And the very first question that I have for you as we kick off here, I did want to also let everybody know, like we've done with the prior health chats, any questions that you have for Dr. Taylor, please be sure to use the comments thread below. We have some questions that we're going to discuss here over the next 30 minutes, but we want to hear what you have, what your thoughts are, and Dr. Taylor will be sure to answer those as I grab those from the chat. But we are going to get started with what we think is on a lot of people's mind, and that is, how has COVID-19, Dr. Taylor, affected mental health?
Yeah, that's a really awesome question, and a very pressing one and a timely one as well. It's no secret that our local area has been hit hard, not just this year, but years prior. If you think about what happened in May 2019, we had a tornado that ripped through the city. Then 3 months later, we have a shooting in the Oregon district, and people really were affected by that. And then the grand finale comes by a year later, where we have a pandemic that really changes how people are interacting with each other in their lives. No longer could you go outside, you could go out in public without a mask. No longer could you see people with a moment's notice. You couldn't really connect. And then the more pressing things that have happened is it's really done a number on the economy, as well as, let's not forget that many people have perished as a result of the illness itself. Yeah. And so you can think that's a lot of things that I've said in a very short period of time, and it would almost be unsurprising if it didn't affect people. But because people don't know what to expect, it seems like sometimes when you're getting affected by all these stressors, you may feel like you're losing your mind, you're going crazy, but the fact is, no, that's just not so. So it is kind of expected to feel down and sad in response to this. It is almost expected to feel anxious about this, and having temporary changes in sleep, appetite, and being able to keep your mind focused on things. But because that might be such a deviation or a change from how people are usually meant to be, they may feel like they're not doing right. And that, of course, can add on to the anxiety they already experience. So you can see that that could all come together to really affect how people are doing.
Yeah, and it's interesting because, like it's been with just conversations about flu and any other type of sickness, it feels like COVID-19 has just, it's been everywhere. And so my next question is that, how does somebody know if the way that they're feeling, if they're feeling blue, is related to COVID-19 or potentially a symptom of something larger?
Sure. So that's a really important question too, because a lot of times it's important to delineate or distinguish when do I need to seek help versus what is kind of normal to be expected. So, a part of a normal reaction would be feeling sad on the order of hours to days, or feeling anxious on the order of hours to days, and having that fluctuate over time. And then another thing to realize is that a lot of times anxiety can be the same thing as worrying a lot. A lot of times anxiety gets kind of confusing because people will talk about anxious in so many different ways. They'll say they're anxious for something to happen, but they mean they're anticipating, they're looking forward to something happening. Where in fact, where we use the term anxiety, it means that you're worried, you're uptight, you're tense. So again, having that last for on the order of days to hours would be a bright line there. And then also having problems with sleep, problems with appetite, problems with concentration. Again, that can happen, but if it's lasting on the order of hours to days, that's probably not something that really needs attention. But if it's lasting longer than that, then that would mean, hey, that's something that needs to be looked at or at least be evaluated. The things that, but when I talk about how long things last, it's also important to talk about severity. So if things are really profoundly disabling, and how would you know that? Well, if it's getting in the way of day-to-day functioning. If that's happening, you may not need to have a whole long time to decide there's a problem. If things are getting in the way of being able to take care of yourself, being able to work, go to school, then that might mean the time frame is a little more short to be able to decide that, hey, I need to get help or things like that. And then lastly, if you're having thoughts about wanting to end your life or thoughts about wanting to hurt anybody else, that doesn't need a duration. That means, yeah, that's probably a sign that a person isn't doing that well.
Yeah, and I'm also curious because I'm sure it's been talked a lot. Is that individuals that may have been feeling these symptoms before the onset of the pandemic, and have you found, Dr. Taylor, that the pandemic itself and a lot of these, like you mentioned, things that people have never faced before in their lives, moved things along in their symptoms, or is that not typically the case? Like, is that a possible? Because you hear that a lot, right? You hear people were maybe already dealing with some challenging things, and then obviously the pandemic hit.
Yeah, I think that's would stand to reason, and we've actually seen that in reality. That people that were doing relatively okay but had, psychiatric conditions, this really caused some of them not to do so well. And of course, that can kind of be disheartening. But the thing is that that's also expected just because you have something going on from a psychiatric perspective doesn't mean that you would be insulated from real life. No, real life can actually affect people pretty profoundly, as we are seeing all over. So I think of it as being that you don't necessarily have to have a psychiatric condition to do not so well during this challenging time. But also if you have a psychiatric condition, it can certainly make it a lot worse and a lot more challenging. And that's actually something that we've seen.
Yeah, and I know we're in spring, and I know that there's always a lot of discussions around, seasonal depression and all of those things. Right. So I'd love to have you talk about that, like why traditionally spring has been at times the darkest time for mental health.
Right, and that's actually what spurred us on to talk about this now, because we were, the people that I work with are thinking about, we knew that people were being affected by COVID, but we also know that typically there's a surge in need of mental health services in the spring. So you can think about that would be the perfect storm right about now, that it's springtime, and we've got this long-standing stressor that seems to have no end. I mean, there's hope in sight, but the thing is that people want to be done with COVID yesterday. So why would that be so? There are a lot of speculation about that. I can't say chapter and verse why this is so. Sometimes it's thought that because the sun is more plentiful this time of year, it can actually give people more energy. And if they've been thinking about not wanting to be alive any longer, if they've had suicidal thoughts, that energy can translate into action. And so, yes, we do see a surge in suicides this time of year, regrettably so. Another possibility is that a lot of times people can rationalize feeling poorly during the winter and during the winter holidays, because we know that's what we should expect. But if you've been feeling poorly for that long period of time and spring comes along and you're no better, then of course that could lead to despair as well, because you're supposed to be better. The sun is out, the trees are budding, and it should suggest that you're doing better. But a lot of times if your mood doesn't fit that scene, then you can feel really alienated and feeling like, gosh, this is just never going to get better. And then also sometimes people are thinking about, at least there's been some research on this topic, that depression sometimes can be stimulated by an immune response gone awry. And so if we've got a lot of allergens floating around in the atmosphere and that stimulates the immune system, then sometimes that can trigger depression. And I know that sounds kind of fanciful and kind of far-fetched, but we are finding some connections between immune disorders like lupus and rheumatoid arthritis, and them being correlated with depression. So those are some of the factors of what we think about in terms of why spring is such a challenging time.
Well, and I'm glad you're discussing this, because I think, as I'm sure you can feel like this invisible illness. And I think, you talking about some of those triggers just stresses how important it is. With I know even some of the things you're going to talk about here in a little bit of, reaching out and talking to people and taking this very seriously because of how quickly, some of those things can onset.
Right, absolutely. So the thing is that sometimes people are wondering, if they see others not doing so well, when should I step in? When should I tell them that they're not doing very well? And one thing to remember that's almost surprising is that others around a person can pick up someone not doing well far earlier than the person themselves do. And so remember, if you're reaching out to help somebody, remember that they may not necessarily be aware that they're not doing well. And of course, there's the other factor that sometimes people don't want to admit they're not doing well. And so there can be some kind of pushback towards that. But again, sometimes a gentle persistence in effort can really show a person you care and let them know that, hey, I'm worried about you, they're not doing well. It just takes persistence, but you also have to be careful that you don't turn around and nag people, because that can be kind of annoying and also lead to a greater pushback.
Yeah. So we had a question that I wanted to get to here that was in the chat, and it was along the lines of, people affording help, and what are they to do? Like, if they've recognized some of the things that you're speaking about and they're in that situation, could you just touch on that a little bit? I know we got a lot of things to cover, but I want to make sure, we answer that question.
Sure. So the state of Ohio has actually done this excellent campaign. I wish I would have thought about it myself, but it's stating that it's okay to not be okay. And that goes back to what we were talking about at the beginning, that sometimes having symptoms does not necessarily mean that you've got a psychiatric condition. Sometimes symptoms mean that, hey, extraordinary circumstances are taking a toll on you. So that's a resource. It's an 800 number monitored 24/7. So I think that's an excellent resource. There are mental health providers in the community. Unfortunately, many are kind of overwhelmed by the surge that we've seen, but we can still try to help as space allows. Another resource to remember is that primary care can be helpful in helping out with mental health conditions. I'm a specialist, but the thing is that generalists a lot of times can do a good job with treating mental health conditions as well. And one thing that I've kind of forgotten to say time and time again, but I really want to get it out there now, is that sometimes in the medical field we forget about our colleagues in the clerical field. Spirituality is a very important ingredient towards doing well and overall being. And pastoral counseling can also help somebody with mild depression, mild anxiety, feeling like you're just not doing well. So I really want to put that out there, because in the past there's been almost this alienation between my line of work and the clerical or spiritual line of work, but no, we actually think we complement each other pretty well when we do it right.
Yeah, that's excellent. All right, so what other stresses and anxiety issues have been brought on by COVID-19?
Sure, so one thing I didn't mention at the outset that may slip by me a little bit, but has been really pressing, is that, we've been driven apart by and large. We can't spend the time we'd like to with others, but also some people have been driven together because people are working from home. And so people are suddenly on top of each other. And I think of sometimes, for example, marriages work sometimes because the two individuals aren't there that much. But now if they're forced together more often than they used to be, that can create a lot of friction. So that can also take a toll on folks. And then the homeschooling. I've kind of forgotten about this because my kids are in college right now or graduated from college. But the thing is, I hear about this time and again that I think there's going to be a newfound respect for what teachers do, because the thing is, parents have had to take that role on a little bit. And sometimes us as parents aren't necessarily the best teachers. And I'll say that out loud because my kids and I used to fight about math all the time, so I'm very grateful I didn't have to do that. But I really sympathize with people having to do that now, because just because you're a parent does not necessarily automatically translate into being a good teacher.
Right.
But if people are not doing so well in that, oftentimes they feel very guilty, like, what am I doing wrong? Well, you're not doing anything wrong, you're a parent. A teacher is a different role that sometimes can be translatable, but not necessarily always so.
Yeah, very good point. So this next one, I think about this a lot, and you're mentioning your children or whatever. I kind of think about that same thing, but I think about it for everybody, and that is that I think are we ever going to go back to a normal? That's one question.
Right.
But if we do, we move back to this normal. Can you talk a little bit about how difficult that may be, and some of the conversations you had amongst the colleagues in your field of what that's going to look like for a lot of people?
No, that's a very good question. I'm very confident about normal will return, although there may be some differences in normalcy. For example, I think that we were really tech dependent back in the day, not like we are now, but a lot of times we had our heads buried in our phones and not paying attention to those around us. And I think we're starting to see how we took people for granted, because people are talking about how they miss the human contact, how they miss seeing people truly face to face. So I think you'll see a shift in a positive direction back towards that would be different than how normal was, say, like in 2018. But also, people are holding on for normalcy. I know I am, and that kind of sustains me. I think that's important. We have to have hope that things eventually will get better. It is really hard to see that, because no one is going to be able to tell you by such and such a date everything will go back to how it was. And I think it's really important to recognize that, because we didn't get here overnight. If you think about how 2020 started, there were rumblings far away about a virus, and they grew louder by February. And by March, then things started to shut down, but it was not something that automatically happened nationwide. Things started to change, and no one knew really what to do, and eventually we found our way. I think it only makes sense that we're going to have to find our way out once again, and it's not going to be where someone signals an alarm, all clear, and boom, we're back to normal. No, it's probably going to be a very gradual process to get back to normal. So that's hard to deal with, because we would want certainty, but this example, we're not going to be able to give certainty. I think that it's going to be a gradual shift, and one day we'll realize that, oh, this is normal. And then it's important to realize, because people are holding on for the hope of normalcy. Sometimes you might overthink what that will be like. In other words, you're holding on so hard for that the hopes might be too high. We actually see this in the military community when people are on deployment, and when spouses are separated or significant others are separated, and they hold on to the hope when they're going to be reunited. But then when they get back together, it's not as rosy as they hoped it would be. Why? Because they're different. Things have happened in between times. And I think we need to remember, when we reunite after this, everybody probably will be different. And it might be wise to be patient about that, to kind of allow things to settle before rushing in and saying, well, this is fabulous and everything is going to be so wonderful. Why? Because we don't want to set ourselves up for disappointment. We've had too many disappointing things happen that I think it might be more important to pace ourselves and realize that it's going to be a gradual process.
Well, and I think along those lines, we've all recognized that there are some silver linings, which you mentioned about valuing each other in person, moving away from our technology when we can. And I think another thing that I want to ask you a little bit about is that it seems to be there has been more awareness on mental health. It's why we're on here today talking with you. And so I think that's a positive thing. But when we do, kind of move forward, I know one of the things you and I were talking about before we came live here is this very fine line between people struggling with issues of mental health, the definition of them really needing help. Could you talk about that a little bit? Defining the difference between, well, I've been not feeling good for a while, but really, there's some serious issues that I need to address.
Sure. So, one of the things that's most serious in my field is thoughts about wanting to end your life and thoughts about wanting to hurt anybody else, because I think it stands to reason those involve potential death, and so we're going to take those really seriously. I think, again, it comes down to severity, how profoundly disabling symptoms may be or how much they interfere in life, and also how long they last. So something that's lasting on the order of minutes to hours to days, that may be bothersome, but it doesn't necessarily mean that you're impaired. And then if it's lasting longer than that, then that might mean, okay, that's something that needs a little more attention. Something that comes up time and again for me is, when people see me, they ask me, hey doc, am I crazy? And I get why they're asking that. Unfortunately, crazy is a very loaded term, and we don't use that term, and I would be hard pressed to define it, believe it or not. But I get their point, because crazy gets tossed about as a function of losing your mind, you're not doing well, you're not right kind of stuff. But time and again, when I'm seeing people in my office, I realize that those individuals are ordinary people affected by extraordinary circumstances. And you can see how that really holds for COVID-19 right now. Or they're ordinary people affected by extraordinary symptoms. And a lot of times people don't want to talk about that because of why? Well, they'll be labeled as being crazy, but that's just not so. The thing is that people are really resilient, but sometimes our resiliency can only take us so far. And there should be no shame in seeking services if you're wondering if you're not doing well, because you can see by what I've said so far today, there's a lot of myths surrounding psychiatry. Do I have a couch in my office? No, because the budget won't allow for it, but I wouldn't have a couch anyway because that's not how I operate. It's just sitting together talking like we are, even though we're not sitting face to face, but it would be as conversational as you and I are talking right now. But a lot of times people think it's going to be this weird kind of situation that they're going to feel weird, or I'm going to be weird, or things like that. But I try to be as not weird as I can be, depending on the day. But also it means that I'm trying to put them at ease, because I know people are very nervous when they're trying to seek out mental health, particularly for mental health services, particularly the first time.
Well, and I think what is very encouraging, I mean, I'm looking at it right here. You're speaking, sharing great insight. I'm looking at the thread. And it's just interesting, by just getting this topic out there, by just you and I here, Kettering, putting on this great little session with you and I, there's discussion amongst people. You shared some ideas. There's people that are here helping each other. Where can we get help for this? Where can we help for that? And I think, to your point, I think it doesn't have to be super complicated a lot of times, right? It's conversational. It's awareness. And I think, that's super, super encouraging. And I know one of the things that you mentioned when we talk about being there for each other is that many often times our friends, our colleagues recognize these symptoms before we do. Can you talk a little bit about some of those specific symptoms that, that people could recognize, when it comes to mental health?
Right. So, it's a very good question, because what should other people be looking out for? It's kind of hard to define that, but I think the way I would go is that if someone's probably more withdrawn or not doing things as much as they used to, that's probably a clue that things are not altogether well. Again, the ad campaign that the state of Ohio is running right now is a really good example of that, where they show an image of a mailbox starting to overflow, and they show people typing on the phone. I'm old, so I don't really get this, but the thing is that, how the messages will show the three dots, and they disappear, and they show up and they disappear, because someone's trying to reach out for help, but not sure about how to do that. And I think that's what they're trying to show there. And then they'll show like a gamer where someone's been offline for like a week or two. And I think sometimes those subtle clues, you may think, well, they're just being standoffish, or they're just being rude. But the thing is, a lot of times if people are holding back, that's not rude. They're just not doing well, but they don't know what to do about it. If that makes sense.
Yeah. Yeah, absolutely. And, we had another comments in the thread that I'd love to have you address, and that is around the idea of shame and this societal pressure that there is when somebody feels like they need to help and they want to reach out, and yet they feel that shame, and some people shrug it off. It is real, and I'm sure you see it all the time. So I'd love to have you, address that for those that ask that. How do you help people through that? We need to change that stigma. There's no question, but it's a lot easier said than done.
I know it is, and I think that we're getting there. I mean, if you think about how things were, again, I'm old, so I remember this time, 1970s. Actually, that's when people started to talk more about mental health, but we know back in the 1950s, early 60s, this was something that you just do not talk about whatsoever. So I think the older generation probably struggles with that. Younger generation, we're talking about it much more willingly and openly, but still, there's a stigma even amongst that generation. I think that the way that I would try to deflect that is, well, I'm here talking about it. And it shows that what I'm trying to accomplish here is to say that, hey, if someone's not doing well, I get why they'd be ashamed about that. I get the hesitancy to seek help, but know that help is available. And, I can't promise results. I can't promise that I'll be able to fix everything, because I just won't do that, because it's not realistic.
Right.
But will I try to listen? Will I try to understand? Yes, those are reasonable expectations about any mental health provider, regardless of discipline, regardless of degree. We all want to help. We're all available to listen. It's just taking that first step, which is really, really hard. I get that. But sometimes if you take the first step, you'll find that you're rewarded with things that can be really helpful.
Yeah, and again, I think that's why, Kettering putting this together, this platform, I'm sure you have seen this. I mean, all it takes,
Right.
not always, like you mentioned, because everybody are in different stages of their life or
Yes.
challenges they're dealing with. It could be a conversation like this. It could, be somebody feeling just, some encouragement along the way.
Yes.
That could be the difference between them reaching out. Would love to give some people some direct ideas in regards to what they can do and or should do if themselves or loved one or a colleague needs to find help. So if you could share that as we kind of close out our session today, that'd be great.
Sure. So I can't say this enough. The state of Ohio, their helpline, I think that's really been something that's an excellent resource, because it's staffed 24/7. So you should be able to get a hold of somebody no matter what. They also do texting. Again, I'm old, I don't do this. But the thing is that for the tech savvy people out there, that can be a really helpful way, because they can text in a conversation with you. Locally, mental health people are here to help. Again, it's been a surge lately, so availability is so much of a challenge. But it's not that we don't want to help, it's just that there's so many that we're trying to help out right now. And also remember primary care. A lot of times primary care takes a lot of hits because they're not specialists in this field, but a lot of times I think that they do a very good job of trying to help people. And if they can't, they refer to me. And so that way you have that backup of still, if you go through the primary care avenue and you're not getting better, then a lot of times they'll reach out to folks like me to help out. And then again, because I've been so remiss in saying this before, clergy. Yeah. So much of my business is the spiritual angle. I don't try to push spiritual stuff on folks, because that's not my place. But I do listen to spiritual concerns. And I think that in the past, there's been this big split between what I do and the clergy side of the house, more driven by my side of the house than the clerical one. But I think if we realize that we're all a team trying to help people across the board with their well-being, then maybe that split wouldn't be so strong any longer.
Yeah, no question. Well, I know the team just went ahead and posted in the chat the State of Ohio helpline, 1-800-720-9616. Again, just a phone call. And like you mentioned, caring people on the other side of it. Dr. Taylor, this has been wonderful. I think, I can only imagine yourself and your other colleagues that work in mental health, what it has been like, these last 15 months, 18 months, as you have been out there wanting to help people. Right. So commend you for the work that you do. Thank you. I'm sure that it has not been easy, but it is so important. So for everybody that tuned in, again, we look forward to continuing to bring these Kettering Health chats to you. They're an important way to get out information from these great physicians and what they're doing. And I will let you all know that May 18th is going to be our next health chat, and we will be discussing stroke awareness prevention and signs. And so that will be, again, like we've been doing, 6 p.m. Eastern, right here on the Facebook page, and we look forward to having you all join. So, Dr. Taylor, as we wrap, any last words for our audience in regards to this very, very important topic?
Absolutely. I think that, again, the one thing, the watch phrase that I've been telling people again and again as we transition from a really bad time to hopefully better times is being patient with yourself, being patient with others. A lot of times it's hard to know where the other person is coming from, and a lot of times we're quick to take offense. But if we kind of slow things down and say, hey, maybe people aren't meaning to be mean, maybe there's something going on, we can kind of have a greater appreciation of helping everybody do better.
Excellent. Well, thank you so much for your time. Thank you for the great work that you do. And thank you, everybody, for watching. We'll see you on May 18th.
Thank you. Take care.
Being strong in heart makes a world of difference. At Kettering Health Network, we're leaders in heart care. We deliver more innovative options and perform the most advanced surgeries. And our experts are renowned for saving hearts and getting you back to the beat of life.